everyone. Welcome to this week's episode of Weekly Hope. I'm Kirsten Hagland, and of course, for those of you who tune in every week, you know that this is Elsa, my lovely poodle. She's the unofficial co-host of this show. But it's thanks for bearing with us. We've got actually 2 episodes of Weekly Hope this week, so that's super exciting. And our first one is with a really very, very special guest, and I can't wait to bring her on. But first of all, if this is your first time joining us, welcome. We're very, very glad that you're here and that you found us. We have been doing Weekly Hope for about, I think maybe almost 2 months now. And we meet here every week, and we have clinicians, experts in the field, advocates, people with recovery stories on to talk about their journeys, to talk about topics that they are working on, things they're particularly passionate about. And we give you the opportunity to say hello, to ask your questions, and to find out more. Of course, that's why we here at Eating Disorder Hope exist, is to try to offer resources and give you as much information as you possibly can, whether you're a clinician in the field or you're a family or an individual struggling. We just want to make sure that you feel heard, that you feel valued, and that you have access to resources. So Elsa's going to sign off for a second and say goodbye and have a great show. Hi, Elsa. Hi, Kirsten. That's Eating Disorder Hope. That's Jacqueline. Hello. And of course, too, if you're here, sign in, comment, leave a comment, let us know your name and where you're signing in from. And of course, if you have a question throughout the broadcast, you ask it and we'll bring it up on the screen and we will ask our guest, which it is my honor to introduce now. We'd like to welcome Dr. Irene Rovira. She is the psychology coordinator at the Center for Eating Disorders at Sheppard Pratt, which is in Maryland. And we're going to talk about the work that she does, something she's passionate about, and of course the topic for today being mindfulness, and looking to demystify that just a little bit and also give us some very, very practical tools for everyday life in recovery using the principles of mindfulness. So welcome, Dr. Rovira.
Thank you so much, Kristen, for having me on the show.
Of course. Yeah, we're so glad to have you. And of course, where are you joining us from today? I mean, we see your beautiful painting there in the background, but where in the world are you joining us from today?
Baltimore, Maryland. I'm at the Center for Eating Disorders right now.
Wonderful, beautiful. Yeah, I'm in Germany, actually. So sometimes I'm broadcasting from Switzerland, sometimes from Germany. So I'm in Germany today. Is it just a very practical question, since we're talking about practicalness? That's probably not a word, but practical application today in this broadcast. Is it as hot there in the U.S. as it is over here? Because we have been experiencing a heat wave. How about for you guys?
We've been experiencing a lot of rain. It seems like it just rains like day in and day out, like 7 days straight. And then you get like one day of sun and everyone's out in the park, and then it's just like rain again. So
no, oh my gosh. Well, okay. I wish we could borrow some of your rain. Shauna McCrossan says, hi, Kirsty, and love from Ireland. Oh, thank you so much, Shauna. I appreciate that. So Dr. Rovira, first of all, why don't you give us a little bit of a look into what you do, your work specifically at Sheppard Pratt?
Well, at the Center for Eating Disorders, what we do is we help people at all levels of care. So we treat individuals who need inpatient care, partial hospitalization. We have like a 12-hour program where they're able to eat on the unit, but then also practice in the evening some more independence in terms of blocking symptoms, having snacks on their own. And also we have IOP, which is intensive outpatient program, and that is a 4-day program where they will practice skills and blocking symptoms 4 hours of the day within like group therapy format. And then the majority of the day, which is nice about IOP, is that you are able to still go to school and work and enter the program in the evening, and then still at nighttime be able to block symptoms. And then actually where I'm sitting right now is the outpatient side of things, and that's where people come in, once or twice a week, maybe 3 times, depending on their needs, and are working from an outpatient perspective on mastering skills to block eating disorder symptoms. So
yeah.
It's like the program.
Yeah, the full spectrum. And, I would love to get your thoughts on this, because I just read an article recently today from the New York Times, which wrote a piece about how to distinguish between, for adolescents or young people in particular, something that's just a phase. Like a lot of parents think that eating disorder behavior is a phase, or just the quirks of being a teenager. And they miss the signs and symptoms of a more serious eating disorder. And then the piece went on to talk about those treatment options that were available. And I was, first of all, just really excited that this was appearing in the New York Times. But can you talk about the value of going somewhere where you can get more intensive treatment? And then, you just did a quick run through of what PHP is versus inpatient. But for people who might be listening and debating about the value of really investing more time in a more serious program, like the ones that you offer, what kind of difference that really makes in the recovery process?
I think it makes a huge difference. Being able to attend to things earlier on. I've treated so many patients who have said, and they're in their 30s, 40s, saying, I was younger and I reached out and I said something to their family or providers, and they just blew it off. And here I am dealing with this issue, 20, 30 years later. So being able to be aware and tune into what your child or loved one might be saying, being mindful of such things, being able to get that help earlier on is always going to be better in any kind of difficult problem that a person might be having. So whether it's depression, anxiety, certainly with eating disorders. Probably what gets confusing for folks is that there's a lot of disordered eating that occurs, and it's not necessarily an eating disorder, and that there is a big buy-in, unfortunately, in our culture for that thin young ideal, so that people may not see that as problematic, or also that they might be buying into it just the same, or reinforcing it in some way with some comments that unintentionally may be hurting the person, such as oh, well, you look great, what's your secret? You lost weight, that kind of thing.
Yeah.
That's also, so it's very important to be able to get some guidance. And the center actually has some great resources that you can go online to get self-assessments to see if this is something that either the individual or loved one could look into a little bit more to see if this is something that requires more attention, or just reaching out to your pediatrician and school, or you can call us up and we can do a phone interview, et cetera, screening, so that you're able to see if this requires a little bit more attention.
Yeah, thank you for that. And also, I was reading in your bio about some of the things that you have been focusing on in your work, and read about the group therapy for co-occurring disorders that you kind of launched there. Can you tell us a little bit about that and how that functions and how you work with clients in that way?
Oh, sure. Well, we know, in eating disorders that there's often co-occurring illnesses. Anxiety, depression are often go hand in hand with eating disorders, but also we know that trauma and substance abuse are also things that are often comorbid with an eating disorder. So we actually have a couple of tracks. One is with respect to trauma, that individuals will get both, it's really cognitive behavioral therapy, so CBT for trauma as well as eating disorders simultaneously. We know from the literature that the overlap between trauma and eating disorders can be as high as 80%. Both illnesses have a lot of shame and secrecy around them, so we're not 100% in terms of exactly what those numbers are, but that's a pretty high number already.
Yeah.
And then we also know that substance abuse is a major problem as well, and that's probably what you're referring to in terms of the group that with some of the work that we had started here at the center, making sure that individuals who have a co-occurring substance abuse problem as well as eating disorders, that their needs are being met. Because we really want to, with that, whether it's trauma or with substance abuse, be able to block all symptoms, of all illnesses, so that they can start to feel like things are moving in the direction of improved functioning, and eventually being able to look at some of the thoughts that are behind that would drive that type of behavior to begin with.
Absolutely awesome. Thank you for that. And it's really a perfect segue into the first element of treatment that I think it's really, really neat to have the opportunity to get someone who works in this field, works on this and with this every day, to demystify some of the alphabet soup of recovery terms and the things that we...
Oh, you're so good at all those little terms.
Well, yeah, and for those of us who have been in recovery, or like you, who treat, these become very normal phrases and things, and yet for those who might just be starting their journey or are trying to learn about it as a family member, it can be very confusing. So to begin, you mentioned CBT, and there's another BT, and that's DBT. So I'm actually going to put these up on the screen. Okay. CBT, DBT, for a second. So these are CBT and DBT are two of many tools that clinicians like yourself use in the treatment process. But can you tell us a little bit about each, what those initials stand for, and how they're used in treatment?
I would love to. So CBT stands for Cognitive Behavioral Therapy. And that's actually the first line of treatment for eating disorders. It has decades of research behind it, and it is considered the treatment of choice if someone has an eating disorder. So if my loved one has an eating disorder, I know I'm going to want them to try CBT first. And that's not to say that it works for everyone 100%, but that's the most likely treatment that would be, helpful. What that does in CBT is that it's very collaborative with the patient, and also gets them rolling up their sleeves so they have to engage in doing the work. And so it's really about looking at your thoughts, your feelings, and your behaviors in order to then change behaviors, in order to affect change in the thinking as well as in the feelings. And then we move on to the next phase, which is changing the cognitions, the thoughts, directly in a way to help support the behavioral changes that the person has already made. So for example, with eating disorders, at the Center for Eating Disorders, what we do is we really focus on blocking symptoms and helping them to learn coping strategies, adaptive ways to deal with stressors in the person's life so that they're less inclined to use eating disorder as a way to cope. And then once they have a better mastery over coping strategies to change their behavior and block symptoms of eating disorder, then moving on to some of the thinking that has that if we don't address would end up making it difficult to maintain those behavioral changes. So things like body image or trauma, things like interpersonal deficits or mood intolerance. And that actually probably is a good segue to the DBT part of the question that you had for me, because DBT stands for Dialectical Behavior Therapy. And that was a treatment that was that also has support in the field for eating disorders. It was developed in 1993 from Marsha Linehan and has a lot of adaptations, one of which is with eating disorders. And what Marsha Linehan, from my understanding, noticed is that when she was working with patients with something called borderline personality disorder, it's a certain personality structure that makes it difficult to have stable relationships, she noticed that she used CBT a lot, but there was a piece of it that was very difficult for patients to engage in because of the emotional dysregulation that they were exhibiting. So what we know is that with eating disorders, there's emotional dysregulation. With trauma, there's also emotional dysregulation. And so that when, in terms of my line of work, getting into treating people with both co-occurring illnesses like trauma and eating disorders, I often find myself trying to educate people over helping them with emotional regulation skills. And that's actually one of the modules that is prominent in DBT. And that is, like emotional regulation, mood intolerance is also noted in CBT, but what is unique to DBT, I would say, is the mindfulness concept. Like she really kind of pulled that out in terms of making it a module to help individuals learn how to use mindfulness in a way that then helps them with the rest of treatment. So some people stay away from, I think, mindfulness a little bit because they kind of don't know what that is, and it sounds a little, maybe new agey or something. And today I kind of wanted to talk a little bit about the practical application because I wanted to make it a little bit more accessible.
Absolutely. So speaking of that, mindfulness, we're hearing more and more about this, and actually even outside of eating disorders. I worked in news prior to this, and we see news articles all the time about mindfulness being introduced at younger and younger ages, even in schools as a skill. It being talked about being mindful while you're doing X, Y, or Z, in wellness articles on very large news organizations. So this is starting to come into the common parlance, but as you very well mentioned, that a lot of people have no idea still what this is. So give us the primer on mindfulness.
Okay, so my bottom line of it all is that mindfulness, as used like in DBT, would be really knowing what we're paying attention to and for how long we pay attention to it. So that
go back and repeat that again. So that
mindfulness is ultimately paying attention, knowing what you're paying attention to and for how long you're paying attention to it. You know, and in this day and age, we often find ourselves probably doing things a little mindlessly, you know, or distractedly and not mindfully. So mindfully, sometimes people mistake and think, oh, is that like meditation? Is that like clearing your mind? Trying to, you know, have your mind be a blank space, but that's not it. You know, you might be very mindful over your own anxiety. You might be very mindful over the task at hand. The idea is to learn to be aware and pay attention to what you are thinking or feeling or experiencing in the moment. So that ultimately is what mindfulness really is. And then the idea would be to then practice that and get better at being able to attend to what you're attending to and have that impact treatment. So for example,
yeah. Just quickly, quick question. Why is it so hard? I mean, I really think that it's easy to say, oh, because of technology, we have or because of our fast-paced world, we have so many more distractions, so it's harder to be mindful. But also there's an internal, I feel like, an internal pushback against slowing down and being mindful, even to initiate the practice of this. What is it in ourselves that pushes that initially away, do you think?
Well, I think we're also very much reinforced for that. You know, we're reinforced for multitasking. You know, like sometimes people wear it as a badge of honor, like, oh, I can juggle all these things and complain about it all at the same time. You know, but yeah, I think that's probably been a long struggle, and we could probably, look back and like a lot of philosophers and so forth talking about such things. Like I was actually thinking in preparation for this interview, it's kind of like, I think it was Socrates, don't quote me here, the unexamined life is not worth living kind of a thing. And that's the idea, is like being able to.
It was Socrates.
Awesome.
Yeah.
Girl. So being able to like slow down long enough to just be with oneself. And, what we know about like with eating disorders, that oftentimes body image is a major issue, self-esteem is a major issue, and then being alone with your own thoughts sometimes is very threatening for individuals that I've worked with. So that slowing down and being mindful of this is actually something that they find quite threatening. So being able to get the support to know that it's going to be okay, that, to be able to look at this in a non-judgmental fashion, to be able to look at it more objectively without the more exaggerated, critical statements that they may also be having in their thinking. Which is, I think mindfulness can be helpful not only through DBT, but CBT, because a lot of the work will involve self-monitoring, noticing those thoughts, feelings, and behaviors. But if you have a whirlwind of thinking going on in your mind, it can feel like too much to put it down on a piece of paper. And so folks sometimes come in, I didn't do my homework, in therapy. And part of it is like helping them to problem solve and to learn that to slow down long enough to be able to even catch some of these thoughts can actually help them. That can be an intervention all by itself. The fact that they would have to write this down helps them not have it snowball so quickly. So that can be a helpful tactic.
Yeah, so good. Just want to say, I mentioned Stella says, thank you so much. Of course, this is really, really awesome information. So we're very thankful too that you're here. And thank you, Stella, for saying hello. And also Shauna says, just by being in the present moment, specifically while eating, paying attention how you feel when eating, texture, taste, etc. Which of course goes to, how does this work in eating disorder recovery? You started a little bit, but what do you do exactly in the treatment process and bring mindfulness into it?
Well, at the center, what we encourage folks to do is to practice mindfulness. And we'll have things on the unit such as like a mindful moment, where the person kind of in the morning sets an intention, sets a moment to like think about what the goal is for the day, and to just be mindful of the task at hand and trying to keep themselves present. And then they'll do it like a couple of times throughout the day. Because one thing that we know about any skill is that you have to practice. And so the idea would be that mindfulness can really help you in the moment of distress to be able to stop and then notice and then think about what might be the next best response. Unfortunately, sometimes folks with, folks that I work with may end up doing something quite impulsive, to try to numb the feeling, escape the feeling, or retaliate in some way. and it can be quite impulsive. And so instead, like learning how to stop and not be reactive, but rather more mindful and more active on what is the next best choice to do, next over whatever problem, will be more helpful. But you can't all of a sudden start being mindful in the middle of a crisis. This is something that you have to practice along, all along, and then so that hopefully when, if and when a crisis occurs, that you're able to rely on the skill that you've been rehearsing all along.
Yeah. What are some things that you try to help clients do to facilitate the start of mindfulness? Is it breathing? Is it closing your eyes? Is it what are some of those? If someone is not at a treatment center and they want to trying this at home. Oh, sure.
So that remembering mindfulness is really just like that paying attention thing. So you could do it with anything, but some strategies that we've, that I've suggested to folks is trying something mundane like brushing your teeth and try to be mindful over that. So that if you are brushing your teeth in the morning or in the evening, your dentist probably wants you to do it 2-3 times a day. It's a great, I think, exercise because hopefully everyone is brushing their teeth at least once. And so that that this is supposed to signal that I'm going to try my mindfulness, and so that when you're brushing your teeth, pay attention to what the bristles feel like in your mouth, against your teeth, against your gums, on your tongue, on your lips, where is your body in space and time when brushing your teeth. Now, if you're like me and like most folks, you're brushing your teeth and you've got the mental list going, and so you're actually not being mindful over the task of brushing your teeth. So that's okay. It's all grist for the mill, as they say. And what that means is that just notice that, I started making that grocery list in my head. I'm not paying attention to the teeth brushing anymore. Gently guide yourself back to brushing your teeth and paying attention to that act of doing that. And so that with every distraction, welcome it rather than get annoyed with it. Sometimes patients, unfortunately, if they're perfectionistic especially, they might say, I'm not doing this right, and get annoyed with the fact that they're not doing it, clearing the mind kind of concept again. And really, the fact that you got distracted is an opportunity for you to practice how to become more aware and more mindful. And we do need to practice in doing such a thing. So you could start with something like a mundane task like that, or laundry, or whatever other chore you can imagine. You could sit down quietly for about 2 minutes, let's say, and you could close your eyes or do deep breathing or put a spot on the floor or something, to try to just pay attention to what you are thinking, what you are feeling. Sometimes that could be a wonderful skill, but usually I'll start off with things such as pay attention to like your pinky toe. See if you can attend to your pinky toe. And then, so you'll have, of course, who's paying attention to the pinky, that's hard, and so you'll have some other thought inevitably come in and distract you, but that's okay. The focus is, the idea, the goal is to bring your attention back to your pinky toe. And so those are like fun little cute activities that one can do, and they seem, initially, you'll have to explain this obviously to individuals, because they'll be like, why is my therapist telling me to talk about my pinky toe? It's ridiculous. But I explained to them, I'm like, listen, it's just about trying to practice with something benign, because we're going to move towards some more threatening material, like your thoughts, like your feelings, like your body image. But initially, you have to kind of get the idea behind it first and get the practice. And that even in 2 minutes time, you're going to be distracted. But I need you to practice, being able to like shift your attention back to the task at hand.
Yeah. Wow. So good. And of course this has, excuse me, is very beneficial for the process of relearning again how to eat properly. And often we hear the term intuitive eating, and that involves basically incorporating mindfulness into the eating process. How in the world, I can hear my former ed voice and the recovered person asking me, how in the world, or a person in recovery, how in the world am I supposed to try to be mindful while I'm facing my all-time greatest fear and looking at a plate and trying to eat it? How in the world do I be mindful in that moment?
Absolutely. And so mindful eating is definitely an important intervention, but it also, I think, has to depend on what you're struggling with and where you are in treatment. So
Yeah.
that initially people that struggle with more restricting type of symptoms, mindfully paying attention to the food can maybe not be the best approach for them in terms of eating. They actually may need some distraction at that point and be almost what we would call like mindless over their worries.
Yeah.
Where someone else who might struggle a little bit more with like binge eating, that their need to be a little bit more mindful eating earlier on in treatment might be very beneficial, because to slow them down so that they can taste the food and notice the food and give some time to kind of catch up in terms of fullness and satiation cues. But ultimately, we would want all individuals to have some mindful eating, and an intervention that one can do is looking at the food, describing it, again, very objectively, non-judgmentally, just stating the facts. And when you notice that you're making some skewed statements about like, this is, whatever, fill in the blank there, being able to say, okay, this food is crunchy, this food is sour, this food, is hot, this food is cold, and just being able to give it more objective terms will be a way to potentially kind of use some of that mindful eating practice to help them connect back and recreate a new relationship with food.
Yeah. And how, also, what does it look like to be mindful while you're exercising? Because I know that, yoga is a really wonderful tool to help. At least I think so. One of the things that, because I didn't use any mindfulness in my recovery process, now 10, 12, 13 years ago, it just wasn't something that was being talked about at that point. And so it's something that I've learned about since. And also have incorporated into my life since, because it's awesome. But I'm not always good at it. That's okay. But yeah. But it's one of the reasons why I love yoga, especially as a former dancer, because I really disconnected with my body in my eating disorder. My body was a tool for dance, and so my body was something to be objectified and shaped and all those things in order to do this task well. And so yoga was really healing for me to reconnect with my body and to be aware of the sensations and the gifts of my, all that wonderful stuff about recovering a sense of living in your skin. How does mindfulness play a role in exercise, with things like yoga, with things like reconnecting to your body in the space? Because I found for me that was hugely, hugely life-changing.
Yeah, absolutely. And commend you on that recovery. That is wonderful. And then, yes, you're right, in terms of like, you probably weren't formalizing the words of mindfulness way back when, but ultimately you had to kind of know what you were paying attention to and noticing those thoughts, feelings, etc. To ultimately be able to do, to have recovery. And so that now we like tease that out and called it mindfulness. And I think in terms of like exercise, very much like what you said, being able to reconnect with the body, similar to having to relearn and have a new association with food. You would want also the individual to have a new association with their body, being able to attend to the negative thoughts that they may have about their body, or what it means to exercise. Am I allowed to eat now because I ran a mile, or what have you? Being aware that that is the thinking that's been driving that behavior is critical in order to be able to change that thinking or that relationship and that behavior. Ultimately, if we don't know that that's what's happening in that relationship with exercise and food, then it'll just kind of keep going until that awareness is brought to our attention. So mindfulness, I think, kind of permeates pretty much all our living.
Yeah. Oh, so good. I just want to mention, of course, the Center for Eating Disorders at Shepherd Pratt just commented. It said commonly, individuals with eating disorders may have automatic or intrusive thoughts that direct their behavior. Mindfulness can help to diffuse those thoughts and raise awareness of one's judgments about them, which, of course, is exactly what you have been articulating so well. And actually, I have a question here from Stella that I want to get your thoughts on. Stella asks, what are other tools that can help to distract the mind from shame and guilt and body image issues? And I think probably you have I see the smile on your face. You have a good answer for Stella on that.
Thank you, Stella, for that question. I think in terms of tools, I think partly dissect that question a little bit, is that on the one hand, you have distraction, right, which can be a helpful tool at times. And then we have a lot of tools that in treatment that we would want to use. Distraction is a very big one. We also want to delay symptoms. Mindfulness is a little bit different in that we're not necessarily trying to distract away from something. We're noticing it, but we're going to notice it in a way that is more objective, less judgmental. We're going to try to be more effective in our response with what comes next after using mindfulness. So it's not quite, in a way to try to distract, although it might seem like that when you're practicing like certain tools. In terms of the shame and guilt, I think those are some of the things that I was referring to before in terms of that's the more threatening material. So that's why we would want to practice with more benign activities or exercises to learn the nuances of how to do mindfulness before applying it to such things. I would definitely say, seeking help can be incredibly helpful to continue rehearsing mindfulness. And it is a constant practice. So, for example, I'll often say, have anyone ever learned how to ride a bike by sitting in an office, and talking about it? Probably not. You need to get on the bike. You need to put your hands on the handlebar. Move your legs and start to feel that sense of like balance. And there's only doing will help you understand how to make that happen. So another, if you're asking in terms of mindfulness, like another exercise that can be helpful, I really like counting breaths. This one is basically, this will really sort of trigger things for some people who might be a little bit more perfectionistic like me at times. But basically what you do is you breathe in through your nose for a count of 1, and then you breathe out for a count of 2. And you breathe in for a count of 3, and out for 4. You count your breaths until you get to 10. The goal is not to get to 10. But if you do, that's great. If you get to 10, go back to 1, and you're supposed to count your breaths, over and over and over. The trick is, if you think about anything else besides your breath and counting it, such as, oh, I know I got that appointment later tonight. You got to go back to 1. And so so they're fun little tools to try to like rehearse the idea of what am I paying attention to? And again, you're going to get distracted. And unfortunately, some folks will say, oh, I'm terrible at this. I don't want to do it anymore. But remember, those distractions are your opportunities. They're your, think of it like teaching moments to be able to say, oh, yep, caught myself thinking about that appointment. Let me go back to 1 and start again. So it's really about trying to help yourself tune into what you're tuning into already and just be aware. Ultimately, that does help treatment because by knowing what your thoughts are, then you're in a position to kind of look at them a little bit more objectively and then potentially like weigh the evidence, whether it's a helpful thought, unhelpful thought, exaggerated, not exaggerated. So that this is where mindfulness, I think, has that very practical application to real life treatment, to real life recovery.
Yeah, so great. Also, Shauna says, grounding would be good to use also, the 5, 4, 3, 2, 1, especially when anxious. I'm not quite sure what that is. Do you know what that is, Dr. Rovira?
Yeah. So often we talk about grounding and containment for individuals who struggle with trauma. So that can be very helpful. But grounding can be utilized not just for individuals with trauma, but with eating disorders, being able to kind of ground yourself. What it means is like physically sometimes grounding yourself, like knowing that where is my body in space and time, putting your feet on the floor, making sure your back is rested against the back of the chair, reminding yourself of like where you are in space and time, that right now I'm responsible for breathing, not necessarily solving all of my life's issues in this moment. Sometimes when you're in a crisis, you're so overwhelmed that you want to just take care of it all and make it go away if you can't, resolve it. And unfortunately, that also can be this to use coping maladaptive coping, such as eating disorder symptoms. I think we're referring to the 5, 4, 3, 2, 1. It's literally like sitting there and like naming 5 things in your environment that you see, 4 things that you feel, 3 things that you can feel, and so forth. So it gets you. It can be somewhat distracting from whatever internal stimuli might be going on that is threatening at that moment, to help you reduce your anxiety and manage for the moment.
Very cool. Speaking of distracting,
Oh, yeah.
can you hear that like siren or something going on in the background?
Kirsten, you're very mindful over the siren in the background.
I became aware of it. I'm really, really sorry, and I have no idea why it's happening. But maybe this is a good mindfulness challenge. But yeah, well, thank you, Shauna, for that. I do apologize for that. I hope it's not too distracting. But Dr. Rovira, thank you so much for your time. This has been really, really, really educational. Yeah, can you please give us the website? And we've posted in the comments the link to Shepherd Pratt. But I just want to put it up here on the screen too as well. What's the website if you want to go check out more?
Eatingdisorder.org.
Eatingdisorder.org?
Yes.
That's it? That's your website?
Yep.
Easy.
www in front of it. And how that goes these days.
For whatever reason, it's not. I think we got it up because I was wanting to put, I don't know if it went up or not. Doesn't look like it. Okay, well, we are going to put it in the comment section so that people have.
Sorry.
Yeah, no, we're going to put it in the comment section so that people have, make sure that they have access to that. Great questions, great answers, obviously. But thank you again. Really, really appreciate all the great work that you do and for helping demystify these things for us. And Elsa was here and she was listening the whole time. You know, I practice mindfulness actually when I wash my dog.
Yes, that's right. You can do it at any old time. That's the wonderful thing about it. It's accessible. You know, it's really just slowing down enough to pay attention to what's going on right now.
Yeah. Actually, I have one more question for you. Does music count in being mindful? The reason I'm asking is because I'm a very musical person. Like I mentioned, because of ballet, music was always very important to me. And still to this day, like I love to walk in nature and listen to music. And for me, it really helps me to focus. Does music count as something that helps you to be more mindful, or is it a distraction?
Well, I would say that if you're listening to the music, right? So like anything I think can kind of be twisted into whatever, right? So like if you're listening to music as a way to distract, that is a really great intervention at times, right? At the same time, if it's what you bring to the activity. So that if you are listening to music and noticing your level of attention towards the words, towards the melody, etc., that is probably going to distract you from those, maybe the negative thinking that might be going on otherwise, you know, and so you could say, well, it's distracting from this, but I'm incredibly mindful over this activity that I'm doing right now in the present moment, as opposed to the worry of the future or the regret of the past. And so again, you know, that's part of like mindfulness. So I'm glad, thank you for that question, you know, because it is really about being aware and also staying as present as possible in those moments.
Oh, so good. Good. Oh, good. I'm so glad that music is a it's a good mindfulness technique because it saved my life in many ways. Cool. Well, Dr. Rovira, you're just so awesome. Thank you again for taking the time, and your generosity of spirit and all of this insight has been truly wonderful. Thank you so much.
Thank you very much. Thank you again for having us on.
Yeah, for sure. All right, everyone. We'll just want to say goodbye. Thank you for tuning in to one of 2 episodes this week of Weekly Hope. We will be back tomorrow at 1 p.m. Eastern Time, so be sure to join us. And this interview with Dr. Rovira is going to be up on our YouTube channel, as well as pinned to the top of our Facebook page as well for the rest of the week, so that you can watch it again. And obviously, there was lots of great practical stuff there, as well as wonderful information. So if you want to watch it again, you can. And of course, if you want to share it with family, friends, or loved ones on Facebook, you can click share and spread the message. So thank you again. Elsa says adios, ciao, au revoir, wherever you are in the world for joining us. We will see you all again tomorrow. All right, bye-bye.
Thank you. Bye.